Hey mama, welcome to Momday. My name is Ella, and in this video, we're going to go over some exercises that you can do to help with symptoms of pubic bone pain during pregnancy. Your pubic symphysis joint is at the front of your pelvis, and during pregnancy, due to inequalities of the right and the left side of the pelvis, it can place unnecessary strain throughout each side of the pubic bone and the cartilage joint that connects them, called the pubic symphysis joint, often causing pain with single leg movements or wide leg movements like getting dressed or getting out of the car, often referred to as symphysis pubic dysfunction or SPD. So in this routine, we're going to go through some movements that you can do to help reset the pelvis, create some symmetry, as well as creating some stability through the front portion of the pubic bone. For equipment, you're going to need a chair. You're also going to need a Pilates ball or a pillow, something that you can squeeze between your inner thighs. And then you're also going to need a resistance band. So once you have all of your equipment ready, let's jump into our routine. So for our first exercise, we're going to place the ball or the pillow between our inner thighs, and we are going to do a ball squeeze, so activating our inner thighs as well as lifting pelvic floor and wrapping our deep core muscles with that pelvic brace. So you're going to take a big inhale, expand the rib cage 360 degrees, and then exhale, you're going to squeeze the ball or pillow, you're going to lift pelvic floor and wrap those deep core muscles with your exhale. And then inhale, release. Exhale, everything co-contracts together. And release. Release. Squeeze the ball, pelvic floor lifts, deep core muscles wrap around your baby. Inhale, release. Let's go for 2 more. Release, last one. Squeeze the ball, inner thighs, activate pelvic floor and core. Nice job. Our next exercise, we're going to work on a hip shift to try and reset the pelvis. So what we're going to do is, with the ball or pillow between our legs, we're going to send our right hip back and we're going to push our left knee forward. So we have this asymmetry in the pelvis. Hold that position, and then you're going to squeeze that ball for 5 seconds. 5, 4, 3, 2, 1. Inhale, release. Keep the pelvis where it is. Exhale, squeeze the ball. 5, 4, 3, 2, 1. Inhale, release. Pelvis stays where it is. Exhale, squeeze the ball. Core contraction. Nice, both feet are shining forward. Inhale, exhale, squeeze the ball. Nice job. We're going to do 1 more on this side. Inhale to release, and then exhale, squeeze with that hip shift. Nice job, and release. Okay, we're going to do that on the other side. So we're going to send our right hip forward and our left hip back into the socket. Again, both feet are shining forward. So find that asymmetry in the pelvis with the hip shift. Take your big inhale, and then exhale, squeeze the ball, hold for 5, 4, 3, 2, 1, release. And release, squeeze. Together, core contraction. 5, 4, 3, 2, 1. Remember, we're maintaining that hip shifted position. Squeeze together. 5, 4, 3, 2, 1. Activating those adductors. Squeeze together. 3, 2, 1. Last one here. Find your hip shift. Big inhale, exhale, squeeze the ball. 3, 2, and 1. Nice job. Okay, next we're gonna come down to the floor. So carefully lower yourself down. We're coming onto our right side for a side plank. So we have a co-contraction of our oblique, and then with our ball or pillow, we're also gonna contract our adductors, so our inner thighs. So set yourself up in your side plank position, top hip stacked over bottom hip, top knee stacked over bottom knee. Place that ball or pillow between your inner thighs. You're gonna take your big inhale, and then you're gonna exhale as you push down through that bottom knee to lift the hips. As you do that, you're gonna simultaneously squeeze the ball, lift pelvic floor, wrap those deep core muscles, feel your side body contract as you squeeze that ball, and then inhale, lower back down. So it's all about that co-contraction of the oblique with the adductor squeeze. Inhale, exhale. Nice job. Inhale to release. Exhale, push those hips through. We're looking for a straight line from the shoulders, pelvis, down through the knees. Find that core contraction, and then inhale, release. Good job finding that stability through the front of the pubic bone here. Strengthening that anterior oblique sling that crosses the pubic symphysis joint to help stabilize the joint and reduce symptoms of pain. Inhale, lower. We got one more on this side. Squeeze and then lower down. Good job. Okay, we're gonna come over onto our other side. So laying on your left side now, carefully swing yourself around. And then exactly the same thing over on this side. So starting off by checking your alignment, top hip stacked over bottom hip, top knee stacked over bottom knee, elbow directly underneath the shoulder. Take your big inhale, fill the rib cage with air. Exhale, pushing down through that bottom leg to lift the hips. Squeeze the ball between those inner thighs. Adductors are activated. Lift pelvic floor, wrap that deep core. Feel that side body engage. And then inhale to release. Nice. We've got 4 more. Big squeeze at the top, find that core contraction. And then inhale, lower down. Release. Nice job. 2 more. Good, push the hips through. Inhale to lower, last one. Really squeeze those inner thighs together. Feel that side body contraction. And release. Nice job, mama. Okay, I'm gonna place my ball to the side, and then I'm gonna grab a hold of my mini band, and I'm gonna come back up to my chair to place the mini band above my knees. And we're coming into a hip thrust next with some abduction work. So we're keeping tension on the mini band, pressing the knees out to fire up our abductors. So placing your upper back on your bench or your chair, your upper mid back, you're gonna find a hip thrust position. So we have a 90-degree angle with the knee here in this top position. You're gonna inhale to lower down, and then exhale, press your hips up. Feel the glutes contract in this top position, and simultaneously you're going to keep tension on the band. So keep pressing the knees out against the band. Inhale to lower, exhale, lift pelvic floor, wrap those deep core muscles. Chin stays tucked, gaze forward. Inhale, lower, exhale, lift. Again, keeping that tension on the band. Full extension of the hips in that top position. Nice job. Inhale, lower. Keep pressing out against the band. Nice job. We got 3 more. Inhale, lower, release. Exhale, lift pelvic floor, wrap deep core, push the knees out against the band. Inhale, lower, exhale, lift. Nice job. And release yourself all the way back down. Okay, those are our 3 exercises, and we're gonna do that routine 1 more time. So coming back onto your seat, we're gonna find our hip shifts. We have 5 reps on each side, holding for 5 seconds with each rep. So, ball or pillow between the knees. Find your hip shift. We're gonna send our right leg back and our right hip back and left hip forward. Take your big inhale and then exhale. Lift pelvic floor, wrap deep core, squeeze the ball or pillow. 2, 1, and release. Nice, mama, squeeze. Feel those inner thighs turn on. And release. Good, 5, 4, 3, 2, 1. Release, last one on this side. Keep driving that hip back. Squeeze, 5, 4, 3, 2, and 1. Nice job. Okay, let's do that on the other side. So, left hip comes back, right hip comes forward. Find that asymmetry. And then take your big inhale. Exhale, squeeze the ball, lift pelvic floor, wrap that deep core. Squeezing the ball, 5, 4, 3, 2, 1. Release. Inhale, exhale, squeeze the ball. 5, 4, 3, 2, 1. Release. 5, 4, 3, 2, 1. Release. Nice job. We got 2 more. Keep that hip shift. Inhale, exhale, squeeze the ball. 5, 4, 3, 2, 1. Release. Last one. Hip shift. Squeeze the ball. 5, 4, 3, 2, 1. Nice job. Okay, coming down to our side planks. Again, we have 5 reps on each side, starting off with our right side. Check your alignment before we begin. Take your big inhale, exhale, push down through the ground. Find your core contraction. Squeeze the ball or pillow between those legs as you lift the hips. Feel that side body engage. And then slowly lower back down. Inhale, exhale. Squeeze the ball. Inhale, lower. Nice job, mama. Inhale, lower. And last one on this side, lift those hips, squeeze the ball. Core is engaged. And lower down, nice and controlled. Good job. Okay, let's go ahead and do that over on the other side. Swing yourself around. Get yourself set up. Check your alignment before you begin. And let's take our big inhale. Exhale. Good. Inhale, lower down. And last one on this side. release, good job. Okay, final movement, we're gonna go back to our hip thrust, and we have 10 reps here. So we're gonna place our band above our knees. And then get yourself set up with your upper mid back on your chair. We're gonna inhale, lower down. Exhale, lift, tension on the band. Firing up those adductors. Inhale, lower. Full extension of the hips at the top. Feel the glutes working. Tension on the band. Nice job. Inhale, lower. Exhale, lift. Finding that core pelvic floor contraction with your exhale. Inhale, release. Exhale, lift. Good job. Keep that tension on the band. And last one here. Good job. And lower yourself all the way down. Well done. Okay, so I recommend doing that routine daily until your symptoms start to improve. I always recommend seeking help from a pelvic floor physical therapist so that you can get an individual assessment with what's going on at your pelvis that's causing this pubic symphysis pain. But here are some exercises and a routine that you can do daily to help manage and hopefully relieve some of that pain. Thank you so much for joining me, and I'll see you in our next session together. Bye, mama.